Have you ever thought that occupational therapy is something related to a job when you heard it for the first time? Well, occupational therapy is therapeutic use of everyday life occupation for the purpose of enhancing or enabling participation. And here's an interview with an occupational therapist.
So OT services are provided for those who require habilitation, which means children who have acquired the illness since birth. So then occupational therapy provides habilitation for children, rehabilitation for adults who have lost their skills due to an injury, due to an illness. So then it's habilitation, rehabilitation, and promoting health through health promotion, and as well as illness prevention for both clients with disability as well and even clients without disability according to their needs. We will gather clients' detailed history where we will frame the occupational profile of the client. So why the client is seeking occupational therapy, what is his concern, what is her priorities and all that. And then we gather the history of presenting illness, what's the social history, how was she before the illness, how is she now. After gathering the history, then we move on to conduct an assessment. Our initial assessment is conducted based on what we have gathered through the occupational profile. So we extract, so what is the priority of this client? Is it to go back to work? So that our intervention can be tailored to the prioritized goal. After conducting the assessment, based on the assessments that we conducted, and then we'll do analysis of activity. For example, maybe a housewife who's having some difficulties preparing meal for the family. So we'll say, okay, come, let you prepare the meal. We'll analyze the activity and see where is the deficit or where is the challenges. Is it through motor movement? Is it your processing skill? Is it your cognition? Is it your executive function? So we'll be able to identify through activity analysis. So once we've conducted the assessment, then we move on to goal formation, like I said just now, before we move into intervention. So we sit with the client and say, okay, this is all we have gathered so far through the assessments. What is that you would want to address first? So then we formulate the goals with the client. So it's usually client-centered. So we'll say, okay, so which one is your priority? So we have short-term goals and long-term goals. So short-term goals, something that we can achieve within 3 months. So we quantify like that. And then which one requires more than 3 months? It will be long-term goals. And then interventions is conducted accordingly. I think the first one is when people hear the word occupation, people think we find job for people. But then I would also take this opportunity to define what is occupation. Occupation in the context of occupational therapy is everyday things that a person does individually, a person does in family, a person does within the community, that occupies their time, that brings meaning and purpose to their life. So occupation include things that people needs to do, people want to do, and people are expected to do. Under occupational therapy, there are 9 core occupations. So we have activities of daily living, for example, dressing, bathing, eating. And then we have instrumental activities of daily living like shopping, using the phone, telecommunication management, and all that. And then we have health management, like how do you control your symptoms, how do you go about your nutrition and physical activity, like that. So we have health management. And then we have rest and sleep, education for children, and then we have work for adults, we have play for children, we have leisure for adults, and the last one is social participation. So anyone who has difficulties in these 9 areas, we are here to help and render our service. Maybe I give you some examples, like maybe an adult who had suffered a motor vehicle accident and he has a fracture. So then he'll have to do splits. So we do splits. And maybe because of the fracture, his range of motion is limited. So because of the limited range of motion of his shoulder, he's unable to dress. So we teach him how to dress. Okay. And then moreover, people with stroke, so they have weakness on one side. So we teach them how to be independent. So that's also the goal of OT. So independence in occupation. So we teach them, for example, one-handed technique. So how you could still be independent using your residual skills. And for children, maybe a child with a special need who wants to go to a school, so they have some attention problems, they're unable to sit still. So all that we intervene so that the child can go to school. And for a person with mental illness, maybe he can't sustain a job because of problems with cognition, problems with hallucinations, so all that we intervene.